So, before we kind of dive into the questions, could you start off by telling us why is it important for parents to learn and know about this topic a little more?
Okay, first of all, when the season changes, right, children do get a lot of infections, and that is definitely very terrifying, like a high grade fever or cough or cold. They are more prone for infections in the seasonal variation, and all the more during rainy season, we get what we call as monsoon fever that comes with the onset of monsoon because of the rains. There will be a lot of water logging everywhere, so the children can get a lot of mosquito bites. So mosquito related infections like dengue, brain fever called as encephalitis can come for them. Also, because of the water contamination, they are also prone to get typhoid like illnesses, typhoid and malaria, because of the mosquito. Typhoid is due to water contamination, malaria again due to mosquito infections. So that is why children have to know about this. Parents have to know how to protect their children when the season changes. Why is it so very important in this particular period? Why? Because for the past 1.5 years, due to COVID, we have not sent our children outside. They have been in the home itself. One flip side of it is, usually when we go to a lot of functions, right? So what we usually get it is we expose them to varied people who may or may not have some mild low grade upper respiratory infection also. So the children usually get immunity due to that low grade infection. So that did not happen for the past 2 years. Say example, a child born in March 2021 has never been exposed to a crowd till now, and suddenly when parents start going out or the child is being taken out, they are exposed to a lot of people who may have a low grade infection, but this child has not developed adequate immunity to any of the infection. So especially respiratory, that is flu virus type of infections are more common now, producing a lot of problem for children. So that is why already the seasonal changes having its own problems, as well as because of the COVID, because of the pandemic, we have not been going out. That is also creating one more problem. The other thing is because there is a vitamin D deficiency, because we are not exposed them to sun. They have been in the home itself. So sun, without sun exposure, the vitamin D levels are also less. The less vitamin D deficiency has been known to increase respiratory tract infection. So that is again one of the reasons.
Thank you so much, Dr. Nanda. So, what are the common diseases which are very prevalent during these changing seasons?
The first and more common is your viral infections, right? What you're getting, the common cold and fever which you're getting. So the commonest disease is that children start, like the child will be absolutely normal in the morning, and suddenly you will see the fever has spiked to about 103 or 104. They will have recurrent cough and cold, and this is the most and severe. Some bigger children can complain about body pain, and some smaller kids will keep on crying. So that is because of the body pain and what we call as say extreme tiredness. So that is might be the reason. So one more thing that happens with these kids is, because of the infection, they may develop the sinusitis infection. So older children above 3 years or 5 years can develop the fever will initially come as very high grade. It will sort of settle down, and the cough and cold will persist for 1 or 2 days, and then suddenly again the fever will increase, and they may complain of a headache. So this is because of the sinusitis. Some very younger children will have cough and cold, and they will have severe ear pain also. So cough, and associated with that the complications like sinusitis, as well as the ear infections can be a very common problem. The next thing is your throat infections, which can come because of contaminated water or exposing yourself to the viral infections. That again is very common. So these are the commonest infections. And then what you're getting is the flu. No, common flu. The common flu, what happens is generally you get a common flu, and then you are totally normal in about, whereas the fever will be there for 2 to 3 days, and after that 7 days the cough and cold will be there, and then it will go off. But some sort of a flu for certain people can go into the chest. So that time we call it as a pneumonia. So that pneumonia is that cold in the chest, and that is because of the viral infection, or it can be not bacterial infections also. So that time the children will have fast breathing also. So that is pneumonia can come. The third thing is the children might not they will not have cold, but they will have very much difficulty in breathing. You would have seen children coughing continuously and requiring some sort of a nebulizers and all. So that we call it as bronchiolitis, or virus induced wheezing can come, which can make the life of the children very very difficult, because they will find it difficult to breathe. They may have a stuffy nose, and breathing becomes very difficult. So this is what we call it as a bronchiolitis. So this all can come, which are the very commonest respiratory tract infections are the commonest during this season. So another thing is, having said that, I told you, because of the monsoons there might be seasonal variation. There might be rains. Because of the rains is all the respiratory infection. Because of the pooling of water in places, you might get mosquitoes everywhere. Mosquito related infections like dengue, brain fever, encephalitis, or malaria is one of the commonest thing. Dengue has actually started spreading in all our places, and I heard one of my friends said Chandigarh is also having a heavy cases of dengue fever. So this is one another thing we have to be really worried. Children have a lot of fever. They will suddenly become very tired, and they might not be drinking enough milk or food, and they will fall. I mean, they will just be very tired. So you have to go to a doctor. See, most of them ask me how to differentiate between dengue fever and viral flu. Definitely, we cannot differentiate in the first 2 3 days. Mostly, they will present similarly like a sudden onset of fever. But what happens in viral flu is the fever is usually go off by about 48 to 72 hours. And when the fever is not there, the children will usually be very active. On the first day, fever may be there for 4 to 5 or 6 hours. But after that, the fever duration starts increasing. So that is something we can, and by about third or fourth day, they will be taking feeds and absolutely become normal. Whereas in a dengue fever or in those pneumonia-like illnesses, the fever will persist, and in between fever also, children will not be very active. The problem with dengue is the problem starts only when the fever comes down. So most of the parents think that when the fever comes down, it is absolutely okay, fine, we need not go. So please don't think like that. If your child continues to be dull even after the fever has gone, you have to immediately see your own pediatrician. So these are the commonest illnesses that can come due to the season.
Thank you so much, Dr. Narmada, for this answer. Asha Kirandeep, who has a 3-year-old child, says, my son is 3 years old. He has severe cold and cough. I have been giving him medicine since 2 days, but it is of no use. He does not want to eat as well. What should I do?
Okay, that's exactly what I was telling Asha. The cough and cold can. Initially, did he have any fever? And how is his cough and cold? Is it a wet cough? Is he not able to sleep well, or he is not able to completely take any foods? Asha, if he is not able to completely take any food, then he may become dehydrated. So if look at his urine output, if it is very yellowish and the quantity is reduced, and your child is always dull sitting on your lap, better consult a pediatrician to see if he is not. I mean, some diseases might present as cough and cold, so they may have some other problems also. It is better to check up with the pediatrician. Let him assure you that it is a normal viral infection. In that case, what you can do to improve his appetite is wait. That's the only thing, because 2 to 3 days the child will generally improve, and you can also give him plenty of electrol powder or juices, homemade juices you can give. So if he likes tender coconut water, you can give him tender coconut water, or if he wants to eat some of his favorite food, whatever it is favorite, you can give him. Slowly, I'm very sure if it is a viral flu, 3 days later his appetite will definitely improve. So don't worry about it. But if he continues to be dull sitting on your lap, not even taking sips of water, and your urine output, usually child passing 6 to 8 times, but now it's just passing one or twice, and that to an yellow colored urine, please go to the doctor immediately.
Thank you so much, Dr. Narmada. Hope this answers your question. And if you have any further questions, please feel free to write them in and we shall take them. So, Dr. Narmada, what are the main areas that a new parent really should be aware of?
What are the
Main areas that a new parent should be aware of.
you mean new areas?
Main areas that a new parent should be aware of when dealing with kids' ill health.
Okay, what are the main things they have to be aware of? Like,
Yes,
uh,
yes, yes.
so the main thing is, control of fever is very important. The fever is very, very, they know, they generally, they will try to bring down the fever to a larger extent. See, generally paracetamol helps for so that the fever does not spike, but then you will not get mm, you will not get a completely a normal temperature. But with paracetamol the child might become completely normal, and mean not completely normal, the fever will come down, sort of he may start taking feeds and all that. So giving a paracetamol or a fever or a syrup to bring down the fever is good. But in the enthusiasm, don't try to bring it to completely normal with other medications. There are other medications that are available in the markets to bring down the fever. Better stick on with only paracetamol. That's what Indian Academy of Pediatrics and many of the bodies are recommending. In a very extreme instant of 104-degree, under the guidance of a physician, when they feel required, they will give you alternate medicines. But generally, paracetamol is a very safe medicine which you can give in your home. So this is one thing you have to keep checking of fever. And some parents use too much of sponge bath to reduce the fever. That is also not acceptable, because children will get very jittery, because you are having it's very already very hot, and then you're putting a cold water on it, you get sort of a chills. So in that condition, what you have to do is just put a towel dipped in cold water over the head in the axillary area and just over the urinary area. That alone will actually help to bring down the fever. So this is one thing you should understand, that do not use too much of a sponge bath. That is going to aggravate the problem. Why I'm talking about fever alone for parents is generally children less than 6 years, and more so in children less than 1 year, the fever is going to be very high. In rare instances, they may develop convulsions, like fits sort of a symptoms. So that is usually lasting for about 30 seconds, and then the child is really sleepy. So you have to go to the doctor immediately at that time. So in order to prevent that febrile seizures, we ask them to control the fever. So these are the one. This is the main area which any new parent has to look at. The second area is about the hydration. How well the baby is hydrated. As Asha was telling in the earlier question that the child was not taking feeds, the flip side of this is the fluids will also be taking a compromise. So we need to give a lot of fluids to the children. So how do you give the fluids? It is very difficult for them to feed, right? So what you can do is give them, which is like electro powder or something, there's ORS powders. That is very useful in this condition. Tender coconut water, or any of the juices generally we don't recommend, but you can give them some dal pani or something like that for them to keep them hydrated. So this will actually help them to make sure that at least the fluids go inside. And then the third thing you have to be aware is about the danger signs. So what are the danger signs the parents can get, but the child can get, is one is excessive drowsiness, that is sleeping. Normally when you have fever you do sleep, but these children will be like they will not, it is very difficult to keep them awake. Once you awake them, and then they are sitting on your lap, and they then sleep off by themselves. They will, it's very difficult to awake. So this is excessive drowsiness. Normally they will do, like, the timing, like 2 to 4 the child will sleep. In a fever maybe 2 to 5 or 5:30 they may sleep. And when you wake them, they may be cranky and irritable, but not like they will go off to, they'll be slipping off to sleep. In that case it's drowsiness, so you need to check up with your doctor, which is fine. Then excessive drowsiness or not at all sleeping, crying continuously, not sleeping at all, crying continuously, please consult with the doctor immediately. The third danger sign is your confits, which I already told you. Child will have some abnormal movements in the body, and even when you call, the child might not respond. So this is something very dangerous. You have to go and check the doctor. The fourth danger sign is persistent vomiting, complete vomiting, and nothing is he's able to retain. You're giving the fluid, he's not able to retain. That you have to again go. Again, the same way is excessive loose stools. This is also something which we have to see. The sixth point is not passed urine for more than 4 to 8 hours. Like morning he has passed, it's almost 6 hours, and he has not at all passed even a single bout of urine in the presence of fever and not taking any feeds also. This is something you have to be aware. So as a new parent, you should know the danger signs, you should know how to reduce the fever, you should know how to give the sponge bath. So don't be very aggressive in your fever management. Also, in a very young child, fever alone is not a manifestation of illness. If the body of the child is very cold, that also will indicate to you that the child is sick and not taking feeds. You will have to consult your doctor immediately. So know how to control fever, know how to give the sponge bath, and third thing, know the danger sign. Something is really not okay with your child, your maternal instinct will definitely help you to know. If you feel something is really abnormal, just get a checkup done from the pediatrician.
Thank you so much, Dr. Narmada. Akshara, who has a 1 year old, says, what foods can I give to my 1 year old daughter to boost her immunity? She catches cold quite often.
Yeah, Ashra, yours is a very pertinent question. So there are two components to it. See, getting a cold too often. What is the duration of the cold she is getting? One person getting about 6 to 8 respiratory infection in a normal year, with a good weight gain and a height, and baby being very active during the episodes, and not even one episode has warranted you to go to the to get admitted in the hospital, that we call it as a normal respiratory infection. So suppose my child gets a fever now, and then 2 days there was fever, and 10 days there was a cold was there. By the time the cold came down, again he developed one bout of fever. Then he had for 3 to 5 days cold, and then after that 1 month there's a break. Again he gets it. So this is also a recurrent infection. But during this episodes, if the child is very active, gaining weight, I will not be worried about. Having said that, if the child is having was hospitalized at some point of time, or he is persistently having cold, that is either running nose or cough, then it may be an allergic problem. You have to again see the doctor to clarify this and get her some relief. The second thing you asked about how to boost the immunity. This is generally for all of us. During the COVID times, we were telling, right, zinc has to be taken, and people were taking zinc by their own, right, and they used to take it. So what we call them as these are all micronutrients. That is, they are required in very small quantities, but they are necessary for the immunity. So, what are these micronutrients? They are the zinc and selenium. I think we did a workshop in Parentune also with regard to the micronutrients that you can see. So, in that we have told how to improve is by eating a plenty of greens and vegetables. That is, this is a not that is a raw, like you cook it in a way thing. You don't overcook it. Like if you're using a spinach, you should cook it so that you use the water itself for the boiling, and then that those sort of thing will hold back the micronutrients. Because if you're going to wash it off, or if you're going to roast it or toast suppose you have the vegetables like lady's finger, people like to roast it a bit and eat in our places. So that sort of a thing should be avoided. You can give it in a slightly less roasted form. So the plenty of green vegetables and the fruits can be given in order to improve the immunity. I do know that children don't like fruits and vegetables, and if I tell them spinach and beetroot, they're just going to run away. So we as a parents have to know how to give it in a modified format. Probably if they like salads, they can give, or you can shred the paneer and the carrots and beetroot over the chapatis and make it as a roll along with cheese and give it. So have some alternate ways how to feed them. So this will actually increase their immunity as well as increase their micronutrients level.
Thank you so much, Dr. Narmada. I hope this answers your question. If you have any further questions, please feel free to write them and we shall take them up. We are joined by a Parentune expert, senior pediatrician Dr. Narmada Ashok, to talk about how to manage and handle illnesses in the changing seasons. So, also, Dr. Narmada, what are the warning signs for parents to help them understand when to seek an expert?
Right. That's what I already told you about. When to seek an expert is high grade continuous fever. If it is not coming down, child is very dull during those episodes, not taking any feeds, having continuous vomiting or loose stools with not passing urine for more than 4 hours. The body temperature appears very hot, but the that is your hands and feet are very cold, very cold. I mean, generally when the temp fever is there, your hands and feet tend to be a little cold. But this is like extreme cold, or the child is unusually sleepy, or unusually crying, or having the involuntary movements like what we call as convulsive fits. These are the danger signs, that the warning signs that the parents have to understand and have to go immediately to the pediatrician. If it is a low grade fever, child is active during those episodes and having 1 or 2 episodes of vomiting or diarrhea, child is passing a little reduced quantity but not so, just 3 or 4 times urine, that's absolutely fine. You can wait. But these are the certain warning signs.
Thank you so much, Dr. Narmada. Richie Ghai, who has a 1.5-year-old child, says, my baby is 1.5 years old. She only takes milk, does not want to have soups, fruits, etc., and she's suffering from cold and cough pretty often. Please suggest how can I give her fruits and give me some home remedies too for cold and cough. Thank you in advance.
Yeah, thank you, Ruchika. I do. I just it's exactly what I told you, right? Children don't want to eat. So how do I give my fruits and vegetables? You have to try some alternate format to give. One of the main problem in this 1.5 year old is taking too much of milk, Ruchika. So the milk actually what happens is it not only reduces the bioavailability of iron, right? Iron, it's very important for the hemoglobin. It sorts of produces, if you don't yeah, have iron, you have anemia. That is one. And these children are more prone for nutritional anemia. That is why it is like poverty in midst of plenty. That is, you are giving a milk so much. It's a rich milk, but what happens is it is stopping the iron, even if it is available in the milk in a very small quantity, from getting absorbed. This does not happen with breast milk, however, because you have the bioavailability of iron is very high. However, that milk can also interfere with the child taking any amount, any nutrition. And you have already said that, that he does not take any feed and he's basically stuck on this milk diet. So another problem that comes is he will also have constipation. The motion, passing of motion will also be very tight. So these are the two twin problems that they come across when they drink a lot of milk. Reduction of hemoglobin and having iron deficiency can make them prone for infections. That is what I told. Vitamin D in the first question itself, it's more prone for infection. So you have to increase the iron content. Having said that, what you can do is sort of use honey, jaggery instead of white sugar. Jaggery can be used, and you can the fruits like sitapal has got a lot of calcium. The spinach has lot of iron content, so you can make some spinach cream soup, or you can make some veggie soups which has got little. You can add a little bit of a cream for the taste. And as I told you, you can make a very flashy rolls. Like you use beetroot, the green color will come, the red color will come up. If you use spinach, the green color will come. The children are attracted to colors, so you have to make the food colorful naturally, not use any coloring agent. You can add the home based remedies for cold, like honey, turmeric is really good. Ginger you can use. Honey is also a very good soothing agent for the throat. So we usually don't advocate cough syrups. We should People keep asking, the child is having a nasal block or not able to eat, and that's like hacking cough is there. Last 1 week I've been really suffering with these children. They're really pathetic to see them, because such a small chest and they keep coughing. It pains them so much. So what I tell the parents is, you give too much of cold medicines also, they become very drowsy, and they're not getting this. When you take cold medicines, you have to sleep, but the moment you put down your head on the pillow, the child starts coughing again. So they become very irritable, because they want to sleep, but the medicine is making them drowsy, and then but you're not the cough is preventing them. So just we have to give them honey based syrup along with ginger or turmeric can definitely help. Honey mixed with hot water.
Thank you so much, Dr. Narmada. Mani Nagpal, who has a 2.8 months child, says, my baby is 2 years and 8 months. She is suffering from cold and cough in every 20 days. What is the reason? Is this because of the season change or any kind of allergy? How can I get to know about the problem and what should I do?
Hi, Mani. Just we discussed about recurrent respiratory infection. A 2-year-old can have about 6 to 8 infections in a month. Having said that, I mean 6 to 8 infections in a year. Having said that, most of the infections are concentrated usually during the seasonal variation. The seasonal flu is something that comes during the rainy season, and once they will have the fever, and after the 2 days it will go, and the cough and cold can persist for more than 20 days, and again they can have a bout. In this condition, what happens is the fever is the first to come. After that, the child will be absolutely normal for about 5 to 10 days. Whereas if you see the allergic conditions, right? Allergic condition, the cold and cough actually starts first, and then the fever come. The fever may come or may not come. The cold and cough is the predominant one, and usually in the allergic conditions, that is, they are generally more so in the morning time, early morning time. The child will have the sneezing episodes. They may have a watery runny nose, and they may have a red eyes too. So these are certain things that can tell you that it is due to a allergic reasons. So if you have any doubt, if the weight gain of the baby is perfect, if the child is very active, then nothing to be much bothered about, but you can consult with your pediatrician. However, if the all the infections are accompanied by the fever, child is very dull during the season and not gaining weight, please go and consult your doctor immediately.
Thank you so much, Dr. Narmada. Dhruvika, who has an 8-month-old child, says, my baby is 8 months old. This month, for the second time, he's having vomitings for 2 3 days during both the episodes. He is not able to take milk or any semi solid. He looks really weak. What can be the cause for such frequent episodes? And also, he's having loose stools. What can I do?
Okay. Having the cough and cold and loose stools together is an indication of having a viral infection. As I was discussing in the earlier questions, a child having about 2 to 3 episodes, 6 to 8 infections per year, and about 20 days interval between the episodes in a month is absolutely normal only. But however, if you feel that your child is very weak and not taking any feeds, you can add on some multivitamin syrup from the doctors, which you can have, which will have zinc content and iron content in it in order to increase the immunity. But suppose the child is the vomitings are very severe, the loose stool is very severe, child is not able to take any feeds, and eyes looks very sunken, mouth is very dry, his urine is decreased, please go to the doctor immediately, because the cough and cold we do know that we can manage, but if the loose stools are very out of proportion, and you're not able to give him also any fluids, probably the doctor can help you with giving the oral rehydration syrup, or in very rare instances he may require some IV route also. So without seeing your baby, I'm not able to give immediate consultation, but if you feel he's dehydrated, please go to the doctor immediately.
Thank you so much, Dr. Narmada. Naina says, I have a child who's 1 year and 2 months old, and she's unable to sleep the entire night due to blocked nose. Please suggest some home remedies to deal with the same.
Hi, Naina. I do understand blocked nose is a very troublesome situation, especially in this winter season. What you can use is a normal saline drops, right? So you also have normal saline solution that has come with some companies. They actually help you to give a nasal wash. I'm not talking about medicated salines. I'm just talking about a simple, plain, normal saline. So you can use either as a normal drops for the newborns, or in little bigger babies like yours when it is about 1.5 years, you could use a saline wash that can be helpful. And one more thing is, you can put the baby in a slightly the neck in an little elevated, not very elevated, little elevated position. Also make them to sleep in their sideways or if you are around, if the if complete prone position is comfortable, so that the stomach pressure is decreased, so that so sort of positions which is comfortable to them can be of much help. And keep the room warm and humidified. Actually, if you're using a dry, make it very dry. The warmth also makes the air very dry. That will also produce a lot of complication. If you're keeping it in a cool condition, it really aggravates the problem. So it has to be warm as well as in the humidifier. It has to be little moisture content. The best way is to regulate it is you can use an air conditioner or you can use a humidifier that is available here. And one more thing is, give him plenty of hot fluids that can be given, like hot water can be used. I usually don't advocate the nasal, the ointment applications and all that, because sometimes they develop allergy. In our places, they used to rub the camphor also, but camphor also has they can produce fits in a child if it is given, if it is inhaled more. So you may use a very small quantity. If the cough is more, you can give honey based syrups can be used. So basically, normal saline helps to relieve the nasal block as well as your posture, and keeping them in a warm environment helps during the night.
Thank you, so Dr. Narmada. Also, coming from the same question, quite more than often it's said that during winter or rainy season, you're not supposed to give fruits to your child. Or
Hmm.
after 4 p.m. or 5 p.m., you're not supposed to give fruits to the child because it can cause cold. So, how true is this?
And that's what I told you, no, Niti. Like, actually, if you are being allergic to foods, right? Foods like citrus fruits, or the apple. Apple has got a cross reactivity to birch pollen. Pollen is one thing that can cause allergy. So during this condition, child might develop an allergy to it after eating. So how do I know if that is an allergy? If it is eating, then they will develop swelling of the mouth sometimes, or immediately after eating, within 1 or 2 hours, child will develop a running nose, will have a cough, or will have the running eyes will be very red. So these are all conditions that can tell us that the child is allergic to. On top of it, he might have wheezing like symptoms also. So that is the condition when we think about the allergy. If that is all not there, okay, sometimes banana can produce. Banana has got a lot of serotonin and histamine. These are certain chemicals that can lead to a symptoms that resembles a cold. So banana is that, again, there are different families of banana. Not all bananas can do like that. So you can sort of see that if you're giving this, and definitely there should be a temporal association. By what I mean is, every time you give banana, within 2 hours he is developing it, then banana is a culprit. How can I know that? Just make a food diary, and recall method we call. So we can just give that. And the other thing for you is, the allergy, if it is not so, all the other fruits can be given, like sitapal or apple juice or papaya, everything you can give.
Right. Thank you so much, Dr. Nalmada. I encourage you all to watch the entire video on Parentune to understand how to protect your child from health issues in this changing season. Also, Dr. Nalmada, can you give us top three do's and don'ts in order to protect your child?
Yeah, the top three do's is: be positive, keep your child warm, do not expose them to unnecessary crowded places during the season, and get yourself vaccinated. That is very, very important. And also complete vaccination for your child, which includes flu and pneumococcal injection. The don'ts are, don't get anxious, don't get paranoid. Everything is not a very severe illness, but don't wait too long also. If you have some warning signs, get to the doctor immediately. Don't use too much of home remedies thinking that it will recover. So you give a home remedy for 1 or 2 days, and child shows some improvement, you could wait. But don't wait for too long to approach the doctor. So these are the don'ts.
Thank you so much, Dr. Nalmada, for talking about this and for all of you for joining us today.
One more dose I want to add. Sorry, Niti. It is
Yes,
not
yes.
not to give home antibiotics. I'm very sure all the parents will know that for a cold you give amoxicillin or azithromycin. Please don't use that. For a viral infection, none of the antibiotics is required. It's just a supportive treatment. Too much of antibiotic is, it's a very strong weapon which is in our hands. We have to use it judiciously. Use antibiotics one and only if the doctor recommends, and complete the course of antibiotics even if your child becomes better.